Welcome back to Bloom. You know, living in Florida, we get a lot of exposure to the sun, which can put wear and tear on our skin, especially our hands. Often our hands can look years older than our faces, but they don't have to. Joining us today to talk about hand rejuvenation is Dr. Hermann of Hermann Wellness. Welcome back, Dr. Hermann.
Thank you, Carissa. Good to be here.
So I'm excited to learn about this because I feel I am guilty of this, of taking so much care of my face, but then we neglect our hands.
Yes.
Why?
Right. I mean, you know, we look at ourselves in the mirror, we do what we need to do, and then we only think about our hands when we get in our car and we're like, oh,
I didn't, you know, they look older, you know, and I'm
Right.
sure you have patients that come to you, they've been taking great care of their skin, you've been helping them with their skin, but you can tell their age when you look at their hands, right?
Yeah, so there's so many things. I mean, essentially we can do for our hands what we do for our face.
Really?
And neck, by the way.
And should we?
Yes,
Okay.
of course.
Yeah.
I mean, first things first, sunscreen, always on the
Okay.
hands, especially the driver's side. But, you know, we often do lose volume in our hands, same way as our face. So the hands do get a lot of sun exposure, so they do age maybe more quicker than, say, our forearm or our leg.
They're getting more unexposed, you know, they're unexposed. We don't, if we go to the beach, we're putting sunscreen, and even maybe then we're not taking good care of them. So they're getting the brunt of all this.
Yes.
Is it one magic hand treatment, or are there different levels for different problems?
So same thing as with face. When I assess a person for face and hands, it's, you know, here's the sort of the signs of aging. Volume loss. You know, if we lose volume, we start to see the bones of our hands, the veins. So adding back volume can just make it look youthful and plump again. Some people more than others have pigment issues where they'll get brown spots. That is correctable with IPL, laser. Yes, and such an easy fix. I mean, you can do that in, you know, literally 10 minutes when you're talking about the hand. Usually we make an appointment longer so we can discuss details,
simple,
but it's very simple, no pain, no downtime.
All of these are non-invasive that we're talking about.
Right, exactly.
Now, what about the Morpheus, which is something we know is so dramatic for the face and neck? Does that do anything for our hands?
Yep. So the three things so Morpheus addresses texture. So the three things when I'm dealing with anti-aging of the face or neck is loss of volume, pigment abnormalities, and texture.
Okay, so we can address all of those. We can do
the Morpheus, which helps with fine lines, wrinkles, laxity on the hand as well.
And is it a dramatic? I think we have a before and after we can look at to sort of see those results, because I definitely know as I age, I worry about my hand sort of giving me away. So we've got this picture here, so tell me just a little bit about what we are seeing.
This person, you know, does not have too much pigment issues, but IPL, I will tell you, can absolutely, if someone does have spots on their hands, just take it away. But you can see where the veins and a little bit of the
definitely, I notice the veins a lot, and I think that's what sort of we might be self-conscious, and I definitely notice less of the veins right there.
This is
what
a
about
treatment.
Pain with any of these treatments? They're non-invasive.
Non-invasive. We usually do put a numbing cream on before we were to do either Morpheus or filler. The filler we typically use in the hands is called Radius. It lasts 1 to 2 years.
Okay.
A lot of times if someone's not sure, we'll start with 1 syringe, although the typical treatment is 1 per hand. So if we start with 1, we'll start with half per hand, let the person kind of just decide if they want more. With the numbing cream, you may feel a pinch or a prick when it is but not invasive. You go back to your work, go back to your day.
You do it in your office and just a little bit. Is this something that men and women equally could benefit for?
Yeah, absolutely.
Okay, so if you got a husband there too, you've been noticing a little difference. You can come in together, sort of get that rejuvenation together. This sounds fantastic. Is this a procedure that you've had?
Yeah.
Yes?
Oh yeah.
Let me see those
hands. Okay, well.
I'm just kidding. But it's something that you've tried everything, and it's something that you recommend and you think really works.
Yeah. I mean, it's a telltale if you have this beautiful porcelain face and
crepey,
modeled
veiny hands. Yes, we can fix it, Doctor. Well, we can't fix it,
breezy.
but Dr. Hermann can fix that. And I think this is a great option out there.